What do your CF genetic sequencing results mean? Imagine opening a detailed map of your genes to see what might be influencing your health. When it comes to cystic fibrosis, genetic sequencing results show the specific changes or mutations in the CFTR gene, which is responsible for controlling salt and water movement in your cells. These results help doctors understand whether you have cystic fibrosis, are a carrier, or if there's another related condition. The CFTR gene can have many different mutations. Scientists have identified over 700 mutations, and the genetic test can find about 98% of these. The test looks at the entire gene to find both common and rare mutations, whether they are single-letter changes or larger deletions. Knowing which mutations are present helps determine the likely impact on your health. In most cases, cystic fibrosis is inherited in an autosomal recessive pattern. That means a person needs to inherit two disease-causing mutations, one from each parent, to have the condition. If someone has only one mutation, they are considered a carrier. Carriers usually do not have symptoms but can pass the mutation to their children. When the test finds two severe mutations, often called Class I to III mutations, it usually confirms a diagnosis of classic cystic fibrosis. These types are linked to more serious symptoms like lung problems and pancreatic issues. But some mutations are milder, called Class Roman IV or V, and may cause less severe symptoms or related disorders that appear later in life. It's important to remember that a person's genetic makeup doesn't tell the whole story. Even with the same mutations, people can experience different levels of disease severity. Other genes and environmental factors also influence how cystic fibrosis shows up in each individual. So, the genotype gives clues but doesn't provide a complete picture. Some genetic variants might not cause disease at all or might have uncertain significance. This makes interpreting results tricky, especially if someone has mild or atypical symptoms. That's why genetic testing is always combined with clinical assessments like sweat chloride tests or nasal potential difference measurements. These functional tests help confirm whether someone truly has cystic fibrosis. If your results show two disease-causing mutations, it confirms the diagnosis and helps guide your treatment options. Some medications called CFTR modulators are designed to target specific mutations, so knowing your exact mutations can help determine if you're eligible. For carriers, the results are useful for family planning and understanding the risk of passing on mutations to children. In summary, your CF genetic sequencing results tell you which CFTR gene variants you carry. Two mutations usually mean you have cystic fibrosis, while one indicates carrier status. The specific mutations give clues about how severe the disease might be, but they don't predict exactly what will happen in your case. Always discuss these results with healthcare professionals who can interpret them in the context of your overall health and symptoms. This personalized approach ensures you get the most accurate diagnosis, appropriate monitoring, and tailored care.